You probably walked right past it this morning. Most men over 50 did. It's sitting in your kitchen right now next to your coffee maker, and according to emerging research on prostate inflammation, you've been missing a critical window every single day. I'm Dr. Marcus Sullivan, and what I'm about to share contradicts decades of conventional advice about prostate health. Because while your urologist is monitoring your PSA and possibly recommending procedures, there's a simple addition to your morning coffee that addresses the root inflammatory cascade before it shows up on any blood test. And the pharmaceutical industry has absolutely no interest in you knowing this. Let me be direct. Chronic prostatic inflammation doesn't start with an elevated PSA. It starts years earlier at the cellular level with oxidative stress and inflammatory signaling that slowly enlarges the gland, compresses the urethra, and creates the cascade of symptoms that eventually send men to specialists. By the time your PSA is climbing, you're already deep into a process that's been building for years. Here's what most men don't understand about prostate inflammation. Your prostate sits at a metabolic crossroads. It's surrounded by blood vessels, it's hormonally sensitive, and it's constantly exposed to inflammatory molecules circulating in your bloodstream. Every meal, every stress response, every night of poor sleep adds to the inflammatory load. And your morning coffee, which most men drink for energy, could be doing something far more important for the tissue sitting just below your bladder. If this information is helping you understand prostate health differently, hit that like button and subscribe so you don't miss what's coming next. Now, before I reveal what you should be adding to your coffee, let me show you the 3 massive mistakes that keep men trapped in the inflammation cycle, even when they think they're doing everything right. Mistake number 1. Waiting for symptoms to take action. Most men only start paying attention to their prostate when urination becomes difficult or when a doctor mentions an elevated PSA. But prostatic inflammation is silent for years. By the time you're waking up 3 times a night or dealing with weak stream, the gland is already significantly inflamed and likely enlarged. The window for prevention closed years ago. You're now in damage control. Mistake number 2. Assuming anti-inflammatory drugs are the solution. I see this constantly. A man gets diagnosed with prostatitis or benign prostatic hyperplasia, and he's handed a prescription for an NSAID or an alpha blocker. These medications manage symptoms. They do not address the underlying oxidative stress and inflammatory signaling that's driving the condition. You're treating the smoke, not the fire. Mistake number 3. Ignoring the vascular component. Here's what almost no one talks about. Your prostate health is directly tied to your vascular health. Inflammation damages the small blood vessels feeding the gland. Poor circulation means less oxygen, less nutrient delivery, and more cellular stress. The same inflammatory process affecting your prostate is affecting your erectile function, your cardiovascular system, and your metabolic health. It's not isolated. It's systemic. So what's the addition that changes this entire equation? Cinnamon. Specifically, Ceylon cinnamon added to your morning coffee in a targeted dose with specific timing. And before you dismiss this as another internet health trend, let me explain the mechanism that makes this work at the cellular level. Cinnamon contains bioactive polyphenol, particularly cinnamaldehyde and procyanidins, that directly inhibit the COX-2 and 5-LOX inflammatory pathways. These are the same pathways that pharmaceutical anti-inflammatories target, but without the gastric bleeding risk or the cardiovascular side effects. When you consume cinnamon with coffee, the caffeine enhances absorption and bioavailability of these polyphenol. You're creating a synergistic effect that delivers anti-inflammatory compounds directly into circulation right when your cortisol is naturally elevated in the morning, which is also when inflammatory signaling is highest. Link in the description to the full written protocol with exact measurements and timing. Here's the protocol. Use 1/2 teaspoon of Ceylon cinnamon powder, not cassia cinnamon. Cassia contains high levels of coumarin, which can be hepatotoxic with daily use. Ceylon is lower in coumarin and higher in the beneficial polyphenol. Add it directly to your coffee grounds before brewing, or stir it into your brewed coffee. The heat helps release the bioactive compounds. Consume this every morning, ideally on an empty stomach or with a small amount of healthy fat like grass-fed butter or coconut oil. The fat increases absorption of the fat-soluble polyphenol. Do this consistently for at least 8 to 12 weeks. Prostatic inflammation didn't develop overnight, and it won't resolve overnight. But the cumulative anti-inflammatory effect builds with daily exposure. Now, here's what you need to understand about why this works when so many other interventions fail. Prostatic inflammation is maintained by a feedback loop. Oxidative stress triggers inflammatory cytokines. Inflammatory cytokines cause more oxidative stress. The gland swells, blood flow decreases, and the cycle perpetuates itself. Cinnamon breaks that loop. The polyphenols scavenge free radicals, reducing oxidative stress. The anti-inflammatory compounds downregulate cytokine production. And the improved insulin sensitivity from regular cinnamon consumption reduces systemic inflammation that feeds into the prostate. You're not just treating the prostate. You're addressing the metabolic and vascular environment that allowed the inflammation to take hold in the first place. And here's the part that should make you angry. This information exists in peer-reviewed research. It's not hidden. It's not controversial. But it's also not profitable. A 3-month supply of pharmaceutical alpha blockers can cost hundreds of dollars. A bag of Ceylon cinnamon costs less than $15 and lasts months. There's no patent on cinnamon. There's no sales rep visiting your doctor's office. There's no marketing budget pushing this intervention. So it stays buried in journals while men continue down the pharmaceutical pathway, managing symptoms but never addressing root cause. Drop a comment if you're already adding anything to your morning coffee for health reasons. I read every single one. Let me be clear about expectations. This is not a miracle cure. If you have acute prostatitis, you need medical treatment. If your PSA is significantly elevated or rising rapidly, you need a full urological workup. But for the majority of men over 50 dealing with chronic low-grade inflammation, benign prostatic hyperplasia, or slowly climbing PSA, this is an evidence-based intervention that addresses mechanism, not just symptoms. And it costs almost nothing. Combine this with the other vascular and metabolic interventions we discuss on this channel: adequate zinc intake, maintaining healthy body composition, managing stress and sleep, and you're building a comprehensive strategy that your prostate can actually respond to. Because here's the truth that no one wants to say out loud. Conventional medicine waits for disease to progress to the point where intervention is necessary. Pharmaceutical intervention. Surgical intervention. There's no profit in prevention. There's no billing code for teaching a man how to use food-based compounds to maintain tissue health. So that information stays in research papers and gets dismissed as alternative medicine, even when the biochemistry is sound and the risk is essentially zero. You have to advocate for yourself. You have to seek out this information. And you have to be willing to implement strategies that your doctor likely won't mention because they're not part of the standard treatment algorithm. Start tomorrow morning. Ceylon cinnamon in your coffee. 1/2 teaspoon. Every day. Track how you feel over the next 8 to 12 weeks. And in the next video, I'm covering the 5 biomarkers beyond PSA that actually predict prostate disease progression, and why most urologists aren't checking them. This is Dr. Marcus Sullivan. Stay sharp.